When people find themselves homeless, it can be a long road between sleeping on the streets and getting into a house or apartment. The first step may be calling the community switchboard to learn that meals are available at St. Vincent de Paul's dining facility or the rescue mission.
One of the things that I see in this story that is the connection. I mean, we're talking about public health called me to get this lady a stroller, but it starts out way sooner than that because this girl was homeless, pregnant with a young child. She was taken to a service provider. The service provider took her to the MAC, which is the Multiple Assistance Center here, where they are teaching her job skills, parenting skills, turning her from a young teen into a woman, a mother. That with public health helping her get through her medical necessities that she needed while she was pregnant, and then coming to us to get information about the women and children's, to get the stroller so that she could get her 2 children to and from their appointments safely. It's a connection.
Some may be eligible for services at places like the Family Resource Center, North Coast Veteran Services, the Multiple Assistance Center, Arcata House, or a variety of social service agencies. There are emergency or night shelters and transitional shelters, but housing officials say there just aren't enough facilities that provide the first steps to getting someone off the streets. The goal is to find long-term, permanent housing. When teens or young adults find themselves without a home, they may have even fewer resources or knowledge of where to get services. That's where the Raven Project comes in.
Usually we would first introduce ourselves to a youth that we meet on the street and let them know that we're from the Raven Project and that we're a drop-in and outreach program for homeless youth, and that we would like to tell them about our services and ask them if that's okay. Then we would proceed to let them know about what they can do at the drop-in center and the types of supplies that we have in our outreach bags, and see if we can give them any supplies at that time. At the drop-in center, the resources are many. There's a free laundry facility, free shower, youth can eat food. We have a free clothing room with hygiene supplies, clothes, shoes, safer sex supplies, and also a computer lab where they can access the internet and receive assistance with job applications, college applications, homework help.
The North Coast AIDS Project works with people who have HIV or AIDS. When someone is available for their services, project coordinators are able to work directly with landlords and tenants.
Some of the challenges and the benefits of our program, some of the challenges for the clients are that they may not have a rental history, or they may not have references, or they might have bad credit, which can be challenging trying to find a space. Some of the benefits of the program are that we work with them very closely to build rental history. We work with the landlords to give them a client that they're able to have a guaranteed rent every month. And we also work with the clients very closely to help them as the liaison between the landlord. So for instance, if an issue comes up with a neighbor, the case manager works very closely with the client to help modify behavior and to talk to them about the situation, as well as communicate directly with the landlord.
The Federal Housing and Urban Development Agency recently funded 5 housing units for chronically homeless with serious mental illness. The rental units are offered by private owners, and tenants are supported by Department of Health and Human Services staff, so they will remain in housing. The program is based on a national model that has had positive results for the individuals and the community. For those accessing services for the first time at a family or community resource center, workers say the first thing to do is develop relationships.
One of our first tools of empowerment is just to listen to their stories and kind of suss out some of the possible needs that they're wanting. And we usually go over our list of great resources, including our food closet and our clothing closet, and connection to housing resources and jobs and school enrollment for their kids and all sorts of other stuff. And then together with them, we kind of make out a plan. We decide what they need, and we enrich them. A lot of what we're trying to do is build relationship with them, because we realize that's the most powerful thing we've got. Because if they know us and they trust us, even though the first time they come in, what they're getting is a free backpack for their kids, or some free shoes, or some free food, in building that relationship with them, we know that they're going to come back. And the more we get to know them, the better we can ultimately help them in moving forward because they trust us.
Just as there are many reasons for individuals to become homeless, there are many ways to find solutions.
One of the things that I love about this community is the ability for people to reach out, and we know each other. It's a small world, and we know each other's services, and we try to find ways to share information. Well, HUD, in their infinite wisdom, Housing and Urban Development, decided that they would help everyone in the country along with that process by having continuums of care. So they mandated who needed to be at the table talking. It couldn't be just one agency or one type of service. It was to be as eclectic a group as possible. So we would be looking at schools, we would be looking at the police, we would be looking at county, public, private partnerships, homeless services, homeless people. What do folks want? What do folks need? Landlords, builders, really trying to get as diverse a group as possible.